Today I'd like to talk with you about a very real and important topic: our lungs. They often carry many quiet messages we don't fully hear, and in many cases, they speak up during the one time when our bodies are most relaxed: in sleep. Many people assume that you only find out your lungs are troubled when you start coughing, gasping, or wheezing. In everyday life you may feel completely fine. But did you know that sleep is your body's most honest time? If the lungs are having difficulty, breathing and blood flow will be affected, and these changes often manifest through subtle sleep disturbances. According to a study published in a thoracic medicine journal in 2023, roughly 72% of patients with chronic lung disease had already experienced sleep-related abnormalities 6 months to a year before their formal diagnosis, though at the time they brushed them off as just a bad night's sleep. This is especially true for older adults. As we age, lung function naturally declines. Add in a history of smoking, exposure to cooking fumes, air pollution or other lung stressors, and the lungs accumulate wear and tear more easily. So let's talk in detail about 6 sleep abnormalities that are common in people whose lung health is compromised, so you can recognize them early and protect your breathing system. I'll also use examples suited for older adults in the US, so you can see how it applies in everyday life. 1. The moment you lie down you feel chest heaviness and shortness of breath. Many older Americans, let's imagine someone like Helen, age 68, who used to go for brisk walks, may feel fine sitting or standing during the day. But when Helen lies down at night, she suddenly senses a heaviness in her chest, as though a small rock is pressing on her sternum. Her breathing becomes shallow, rapid, and she may need to take several deep breaths just to feel somewhat comfortable. Why does this happen? The mechanics are not complex. When you are standing or sitting, the lungs have more room to expand, the chest cavity is less restricted, and breathing resistance is lower. But when you lie down, your abdominal organs push upward, reducing the space for your lungs. At the same time, blood returning to the lungs increases the load on pulmonary circulation. In a person with healthy lung function, the body adjusts. But if you have reduced lung capacity, perhaps due to something like chronic obstructive pulmonary disease, COPD, lung fibrosis or an ongoing lung inflammation, the adjustment fails and you feel chest tightness and shortness of breath. A 2022 study by the International Lung Health Alliance indicated that about 68% of early COPD patients first experienced positional, lying down breathing difficulty, i.e., difficulty breathing when they lie down, rather than symptoms during active periods. Many people mistakenly attribute this feeling to a heart problem. Yes, heart disease can cause similar feelings, but often the root lies in the lungs. This discomfort is most pronounced within the first 10 to 15 minutes of lying down. Some patients instinctively sit up or prop up their pillows higher. When they do, the symptom eases. That is your body trying to help itself by reducing lung load via change in posture. If you find yourself in this situation, don't simply chalk it up to getting older. It's wise to have your lung function checked, rather than dismiss it as just a sign of age. 2. Frequent snoring after falling asleep, especially when accompanied by breathing pauses. Many people think snoring is harmless, or even a sign of deep sleep. But I want to alert you that not all snoring is benign, especially when the snoring is irregular, loud then soft, with sudden stops lasting a few seconds to tens of seconds, followed by a loud gasp or choking sound. That isn't ordinary snoring. This is often called obstructive sleep apnea, OSA. You might wonder, what does snoring have to do with lung health? Well, while the immediate cause may be upper airway collapse or throat muscle relaxation, prolonged breathing pauses lead the lungs into repeated cycles of low oxygen, hypoxia, and recovery. This damage can degrade lung tissue and impair lung function. Also, if you already have a lung condition, for example someone like Robert, age 72, who smoked for many years and developed chronic bronchitis, his airways are narrowed, making it easier for airway collapse during sleep and thus worse snoring or apnea. A survey by the Taiwan Thoracic and Critical Care Medicine Association in 2024 found that in Taiwanese adults aged 45 and above, about 23% had moderate or more severe OSA, and nearly half of those also showed some level of lung function abnormality. Long-term untreated sleep apnea not only hammers the lungs, it also increases the risk of high blood pressure and stroke. This is definitely not something to ignore. If you or a bed partner notice snoring with pauses, choking gasps, or you wake yourself up gasping, please don't dismiss it as just snoring or just old age. Seek a sleep study and a lung function check. 3. Waking up around 3 to 5 o'clock a.m. for no obvious reason and then struggling to get back to sleep. Have you ever had this experience? You go to bed and feel sleepy, yet around 3 to 5 in the morning you suddenly wake up, completely alert, and then turn restlessly only to finally drift back to sleep near dawn? If this happens repeatedly, it might be more than just insomnia. Could signal a lung issue. From the perspective of traditional Chinese medicine, TCM, the time between 3 a.m. and 5 a.m. is the peak activity period for the lung meridian. At this time, the lungs are meant to be expelling old air, refreshing themselves, restoring tissue. If the lungs are congested, inflamed, or don't function well, the flow of qi and blood is disrupted, and you may awaken. From a modern medical view, we know that between 3 to 5 a.m., blood pressure and heart rate tend to be at their lowest, so any ventilation/oxygen supply mismatch in the lungs becomes more obvious. A 2023 sleep medicine study showed that about 56% of chronic lung disease patients experienced early morning awakening type insomnia, and among them, 79% woke between 3 to 5 a.m. Their blood oxygen saturation upon awakening was 10 to 15% lower than during normal sleep. If your wake-ups at that early hour are frequent for a week or more, not obviously triggered by stress or emotional upset, it merits checking lung function. Don't simply treat it as just insomnia. 4. A cough that worsens at night, especially after lying down. Coughing is a protective reflex of the lungs, helping to clear irritants, mucus, and inflammatory secretions. But if the cough intensifies specifically when you lie down, perhaps preventing you from sleeping, that is a red flag for lung disease. Why is cough worst at night when lying down? 2 main reasons. After lying down, secretions like mucus may move downward due to gravity and irritate the airway lining. At night, the body's vagus nerve excitability tends to increase. That leads to airway constriction and more secretions, thus intensifying cough. If you have a condition like chronic bronchitis, bronchiectasis, or asthma, you are more likely to experience nocturnal cough. For example, Margaret, age 70, had asthma since her 40s and discovered that about 80% of asthma patients, her included, get nocturnal asthma attacks. Lying down triggers cough, wheezing, or a whistling sound in the throat, stridor, because airway sensitivity and lung ventilation drop at night. Also, early-stage lung cancer can present with a stubborn nighttime dry cough, little or no mucus, hoarseness, and persistence for weeks. According to the Taiwan Cancer Foundation in 2024, about 19% of lung cancer patients cited unexplained nighttime cough as their first symptom. So if your cough suddenly gets worse at night when you lie down, especially if it persists longer than 2 weeks and conventional cough remedies aren't helping, don't procrastinate. Get a chest CT scan or a lung function check. 5. Hands and feet feel cold when sleeping and you can't warm them up. Many assume cold hands and feet at night is just poor circulation, age catching up, bad circulation in old folks, and yes, that can be so, especially for older women. But surprisingly, persistent coldness in your extremities during sleep may also point to lung function impairment. Our lungs are the core of the body's gas exchange system, drawing in oxygen and sending it via the blood to all parts of the body, including the furthest extremities such as hands and feet. If lung function declines, oxygen intake falls, blood oxygen saturation drops, circulation slows, and the periphery, hands/feet, may receive inadequate oxygenated blood, hence they remain cold. For someone with COPD, narrowed airways hinder oxygen entry. Oxygen saturation falls, leading to poorer overall circulation, and cold extremities become much more noticeable. Even under thick blankets, they stay cold. A 2022 study by the Japanese Respiratory Society found that among people whose lung function was below normal, about 63% had persistent cold hands/feet. Of those, 82% had the symptom during night sleep. Their extremities' temperature was 2 to 3 degrees Celsius lower than those with normal lung function. Of course, cold hands/feet can also come from anemia, hypothyroidism, or simply low room temperature. But if alongside you have breathing difficulties, chest tightness, cough, don't ignore the lung angle. After all, oxygen is the body's key fuel for warming and powering the body. And if the lungs are underperforming, the whole system suffers. 6. Waking up with a dry mouth, scratchy, or painful throat. Finally, waking up with a dry mouth or sore throat may seem like the room was too dry, I didn't drink enough before bed, or just an allergy, but it may also be a lung issue sending its message. Under normal sleep conditions, the airway secretes a small amount of mucus to keep the throat and airways moist. But if lung function is compromised, say with chronic pharyngitis, bronchitis, or you have sleep apnea causing airway collapse, the mucous membrane activity can be disrupted, less secretion results, leaving your mouth/throat dry and scratchy. Moreover, when lung ventilation is inadequate, the body will unconsciously switch to mouth breathing during sleep to compensate. Mouth breathing causes rapid evaporation of moisture in the oral cavity and throat, so you wake up with a dry tongue and throat pain, maybe hoarseness. Even more concerning, habitual mouth breathing allows dust and bacteria more direct access to the airways, which can provoke or worsen lung inflammation. A 2023 survey in the Pulmonology, Chinese Journal of Pulmonary Diseases, found that about 47% of chronic lung disease patients had sleep-time mouth breathing, and of those 90% experienced dry mouth or throat discomfort upon awakening, and the symptom severity correlated with a degree of lung dysfunction. If you wake up with a persistent dry throat, scratchy mouth, and also snore, breathe through your mouth during sleep, and drinking more water or increasing room humidity doesn't help, then it's time to check your airway and lung function. Don't simply assume it's just dry air or age-related. In addition to those 6, 2 other subtle signals deserve your attention. Beyond the 6 more obvious signs above, there are 2 hidden indicators of lung health worth keeping in mind. Waking up feeling lethargic, weak, or foggy-headed. Ordinarily, after a full night's sleep you should feel refreshed. But if your lungs are underperforming, oxygen supply during sleep is inadequate. Your brain and muscles don't get the oxygen and rest they require. Even if you slept enough, you wake up feeling drained, fatigued, even dizzy. Change in the color or consistency of your phlegm, sputum. While not strictly a sleep symptom, many older adults wake in the morning and notice phlegm. If the color changes, say from clear/white to yellow or green, or becomes very sticky or blood-tinged, it suggests lung inflammation or infection. The Taiwan Chest Medicine Association recommends that if abnormal phlegm persists more than 3 days, get a lung check. Daily lung care. What older American adults can do to support their lungs. Now that you're aware of these signals, what practical steps can you take in your everyday life, especially if you're in the 60-plus age group here in the US, to keep your lungs in better shape? 1. Eliminate lung hazard factors and reduce lung burden. Quit smoking. Smoking is the leading cause of lung cancer and COPD. Even if you smoked for decades, quitting now will gradually reduce your lung disease risk. Studies show that even after 5 years of quitting, lung disease risks drop significantly. Reduce exposure to cooking fumes, air pollution. Make sure your kitchen hood/ventilation works well. On smoggy or high pollution days, go out less often, or wear a good mask if you must. Avoid exposure to dust and airborne particles. If past exposure to industrial dust, for example if you once worked in construction or manufacturing, make sure you have protective equipment when needed. Regular lung function checkups. 2. Practice correct breathing exercises to boost lung function. Diaphragmatic, abdominal breathing. Morning and evening, spend 10 minutes lying flat, hands on your abdomen. Breathe in slowly through the nose, let your belly rise. Then exhale through the mouth, letting your belly fall. This strengthens the diaphragm and improves lung ventilation. Deep breathing exercise. After meals or when you have a clear, clean air environment, breathe in for 4 seconds, hold for 2 seconds, exhale for 6 seconds. Repeat 10 to 15 times. This encourages better gas exchange and helps remove old air. Keep physically active. Walking at a comfortable pace, doing gentle stretching, are all beneficial for lung health. 3. Get your lung function checked periodically. Early detection, early intervention. If you are age 40 or older, especially if you used to smoke or if you have a family history of lung disease, or if you've had significant exposure to fumes or dust, consider getting an annual lung function test such as FEV/FVC measurement. These tests detect declines in lung capacity better than a simple chest X-ray. Many lung diseases are silent early on. By the time you have persistent cough or breathlessness, the disease may already be in an advanced stage and treatment becomes harder. Friends, our lungs are like the roots of a great tree. They underpin each breath we take. Unlike the heart, which beats with an obvious thump, or the stomach, which signals hunger loud and clear, our lungs work quietly and often unnoticed. So we may ignore subtle changes, but those subtle signals often hide meaningful messages. Tonight, before you go to bed, take a moment. How does your chest feel as you lie down? Did you wake up early for no reason? Did you snore or wake with a dry throat? These may seem small, but they could be important. I hope today's talk helps you better recognize how your lungs speak to you, especially at night, and that you'll pay attention to your sleep, the quiet messages your body sends, and act early rather than waiting. Remember, keep your lungs supported, your breathing smooth, your sleep restful. Thank you for listening. I wish each and every one of you healthy lungs and a peaceful night's sleep. Until next time, take good care.